Hi there, my name is Ayana Powell. I'm a student hygienist at Fortis College in Landover, Maryland. I'll be covering dental care post the coronavirus. Coronavirus, also known as COVID-19, is a highly infectious disease caused by a variety of viral strands. Many people infected with COVID-19 will typically experience mild to moderate respiratory illness, but they recover without requiring special treatment. Older generations and those who have systemic health conditions such as diabetes or cancer are likely to develop a serious illness with COVID-19. Common symptoms include fever, dry cough that typically develops after 2 to 7 days, mild breathing difficulties, gastrointestinal issues, diarrhea, general body aches, and severe symptoms include high fever, pneumonia-like symptoms, and kidney failure. The World Health Organization, also known as WHO, stated COVID-19 spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. The Center of Disease Control sets guidelines to prevent the disease, or the spread of disease, rather, by recommending social distancing, which we're well familiar with. This means standing at least 4 to 6 feet apart from everyone. Also making sure that you're staying away from crowded areas and social events that may contain 10 or more people. We want to make sure that we're practicing proper hand hygiene, and they also recommend to self-quarantine when you believe you've been exposed or you suspect that you're showing signs of symptoms of the COVID-19 or flu. So it's said that remaining at least 6 feet apart from everyone can minimize the risk of exposure to droplets. If you're a dental health care professional, you're probably wondering, how am I going to do my job? Let's take a look into this. The dental office is a place where high amounts of aerosols are produced, thus making us high risk for the virus to be transmitted or contracted. It's impossible for us to complete our job while remaining 4 to 6 feet away from our patient. So we have to put some guidelines into place. You may be wondering, what's the solution? Let's start by patient screening. The front desk staff should call and screen patients prior to their scheduled appointment. In addition, they should be screened with follow-up questions when they arrive to their appointment. The patient should be rescheduled if they disclose any information about having flu-like symptoms such as high fever, dry cough, or difficulty breathing. You also want to be mindful to ask them if they were exposed or have been around anyone who had COVID-19 within the recent days. Implement taking patients' vitals at the time of medical history review. Vitals should include blood pressure, respirations, pulse, and temperature. In addition to patient screening, we definitely want to have additional protocol to infection control measures. Now, you want to wipe down all surfaces inside the operatory at least twice with high-level disinfectants in between patients. You want to wipe once to clean and once to disinfect. Definitely run the lines 2 minutes before your first patient of the day and 30 seconds in between all patients. You want to wipe down high traffic areas such as the waiting room and the break room. You definitely want to make sure that it's mandatory to wear more PPE, and I'll discuss that in just a second. You also want to make sure you include more barriers. Along with this, you want to have an idea of how you can limit the amount of aerosols being produced in the air. Let's talk about PPE. Many clinicians wear the standard PPE, which would be your gown, your gloves, your mask, eyewear, and closed-toed shoes. If you take a look here at the clinician on the left, he's wearing all of his PPE, and you have to make sure and be mindful that your lab coats and your gown are covering your arm completely. You don't want any skin exposed during patient treatment. There are additional items that we should add into our standard PPE, such as biomass face shields, hair nets, and earplugs. Now, your hair covers can be more effective if they're disposable, so you won't have to transfer germs, but a cloth hairnet is more cost effective. So it is completely up to the clinician or the office manager. Earplugs are recommended because they limit the exposure of aerosols into the clinician's ears and also the patient's ears. They're very cost effective. You can get a pack of them at a dollar store. Many of you are probably wondering, what about my loops? How can I wear a face mask that fits over my dental loops? Or can I even complete treatment effectively? Will there be a glare? I can assure you there are disposable bioface masks available to fit over any pair of dental loops. You'll probably be looking like the clinician on the right who has their hairnet, their face shield, their loops, and their mask, and you can see their lab coat. You may feel like this, however, just be mindful of the protection that you're placing upon yourself and your patient. You want to make sure you guys are safe and you're not transmitting diseases in between each other. Barriers. There should be a barrier on absolutely everything touched by the clinician, the assistant, and the patient. This includes all dental chairs, suctions, air water syringes, dental trays, the computer, the monitor, the keyboard, the mouse, x-ray equipment, and you definitely want to make sure you're using overgloves for everything. Let's talk about the limitation of aerosols. This picture may look funny for some, however, it could be reality. It's not really recommended because this can limit the clinician to the 12 o'clock positioning. And for some patients who are apprehensive or claustrophobic, it wouldn't be ideal to put them in a plastic box. This picture is also not showing the clinicians wearing the proper PPE, and there are no barriers. So we definitely want to make sure we have those. The use of the high-speed suction during treatment with any handpiece is highly recommended. There may be a possible trend of assisted dental hygiene in the operatory happening very soon. The high-speed positioning is also important. We want to make sure we're directing the aerosols into the patient's mouth instead of outside of the patient's mouth. The American Dental Hygienists Association recommends the use of pre-procedural rinses of peroxide. The concentration should be at least 0.5%. However, dentistry offers mouth rinses that are concentrated with at least 1.5% of hydrogen peroxide. The products would be Colgate Peroxyl and Listerine Whitening Mouth Rinse. Here's a tip. You want to place 2 tips of the slow speed suctions into an HDE suction for better evacuation if you're working alone in the hygiene chair. Let's take a look into dental care for our patient post-COVID-19. Many patients may be apprehensive about visiting the dentist after the pandemic slows down. Many dental offices can even expect a decrease in patient flow. However, it's our duty to ensure that the safety of our patients and ourselves throughout the entire dental appointment is maintained. The patient will gain trust as they begin to come back for treatment and they can tell their friends and their family. We can also use media and science and research to help make our patients aware that it is indeed safe to come back to the dentist. What can we gain from COVID-19 pandemic? There are still studies that are currently being conducted on COVID-19. And although there is no vaccination for COVID-19 as of now, all healthcare professionals should get this vaccine if there's ever a breakthrough in this research. This can protect us as clinicians and our patients from enduring another COVID-19 outbreak. Here are some of my references that I used throughout this research. And I just want to thank you guys for watching. Again, I am Ayana Powell, student hygienist at Fortis College. If you guys have any questions, feel free to email me. Thanks for watching.